Welcome to Elevate Care, the show where healthcare professionals, visionaries, and thought leaders come together to explore the limitless possibilities of healthcare innovation. I'm your host, Jamie Dubke. Welcome to a journey where innovation meets humanity. Today, we're excited to host Barry Asin, President of Staffing Industry Analysts, also known as SIA. He is a distinguished authority in the staffing and contingent labor sector. Barry is not only a strategic leader, but also a prolific voice in the industry, co-authoring Breaking Through Leadership Disciplines from top-performing staffing firms and frequently sharing insights at major industry events. His expertise is regularly featured in top publications like the Wall Street Journal, the New York Times, and Business Week. In this episode, we'll uncover the evolution and future of healthcare staffing, delve into the impact of AI and the pandemic, and explore the trends and challenges shaping the sector. Whether you're in the healthcare industry or simply interested in its future, this episode promises to be enlightening. Let's dive into a thought-provoking conversation with Barry. Barry, welcome to the show.
Thank you so much for having me, Jamie, and looking forward to the conversation.
Awesome. Thanks again for joining us. Barry, our listeners are always inspired by the personal journeys of our guests. Can you speak to the passion or purpose that fuels your work?
Well, absolutely. I've been a client of Staffing Industry Analysts since the early '90s, back in my time there, and the mission is pretty simple. It's all about informing, connecting, and elevating the workforce solutions ecosystem, that whole world of how people get connected to work. And so for me, it's really fun and interesting to see how the world of work has been evolving over the last couple of decades, and the way that people get jobs, and that the employers out there get the workers that they need and get the work done that's important for them. And so it's just that's really what I've focused the bulk of my career on, has been helping executives on all ends of that try to understand what the changes are that are out there and how to prepare their organizations for that world of work.
Awesome. Thank you for sharing. To begin, could you tell our listeners how SIA has played a role in advising healthcare organizations globally? And could you share your vision for SIA's future?
Yeah. So I think I alluded to this a little bit in the beginning. I've been with the organization over 20 years and really seen it grow. As I said, the whole purpose of the business and what I've been doing is work helping organizations look around the corner at the trends and developments that are out there in terms of connecting work and workers, particularly in the work and helping to understand what we call the workforce solutions ecosystem, which is all about all the sort of third-party HR services and solutions that help organizations get the workers that they need. And so that's what SIA has been about. We do that both for the folks on the supply side, organizations like AMN and others who are suppliers in that ecosystem, as well as the end users, the enterprises, the healthcare organizations, and others who are trying to figure out their talent strategy and trying to solve their workforce challenges. And so that's what we're all about at SIA, is helping make that connection. We do that. We talk about informing. We do all sorts of research, 200 research reports a year. And but a big part of our mission as well is building connections. And so we host a number of conferences and webinars and all sorts of ways for people to network and learn from each other. And hopefully what we're doing, and we've seen this over time, is that the staffing industry, which is the core that we started out researching way back when, but now more this whole workforce solutions ecosystem, is getting more professional over time and becoming more sophisticated and having greater impact, and getting more attention at the C levels of large organizations. And I think that's part of our mission as well, is just to help take that to the next level. As far as going into the future, I would just say that this feels like a revolution in the workforce that people sort of wake up and go, wow, this, like these changes are overnight, but any change like that, there's groundwork that's gone on for a long period of time. And so it's like one of those overnight changes that's 20 years in the making, I think. And, the pandemic, well, I know we'll get into that, Jamie,
Absolutely.
but, the pandemic has really just lit some of that on fire and raised the awareness. And so we're excited about that, in that people are paying more attention to new innovative ways of getting work done, to more flexible ways of working, rather than just the old tried and true 9-to-5 job, which maybe was never true in the healthcare world. But, I know we'll get more into that.
No, thank you so much for that. I know our organization appreciates the insights that you provide as well. And you're 100% correct. I think COVID accelerated a lot of those changes. And even though we think those things happened overnight, it's that 10,000 hour principle, right? Like that stuff took time to change. And the generations in the workforce have massive implications in that as well. But I'd like to kind of shift our focus to one of those things that happened last year, which was a significant healthcare strike. And so reflecting on that strike that happened in 2023, I'd love to hear how you see this impacting the balance between permanent and contingent staffing costs in healthcare. And are there any emerging trends suggesting a shift or equalization in those costs?
Yeah. Well, so I think there's a bunch in there. And, the first is just like to think a little bit about like what was driving, all the strikes and labor actions that we've seen. And I know I don't think it's over. So I think that strikes are going to be in healthcare as, I think this is likely to be an ongoing thing here. And part of it is the balance of power between workers and employers, particularly in healthcare. But I think, a lot of the core of this for healthcare workers is, it's about respect, and it's about the levels of burnout that they've been feeling, and, how hard it is for healthcare workers to do their jobs. And so that, I think, is a lot of what drove and has been driving the labor actions. And that in the short term, I mean, what we really saw through the pandemic was, a lot of people leaving the workforce, particularly the healthcare workforce. I mean, at first it was sort of a rush into this crisis to solve the crisis. The healthcare workers are people who really care deeply about taking care of their patients, and it's very mission driven. But at some point, I think that healthcare workers realize that they have to take care of themselves as well. And so that drove a lot of the, and I think has been driving the strikes. And frankly, a lot of what happened over the course of the pandemic was workers who were looking at the deal they were getting in their organization and saying, I need something better. And they realized, I mean, this is particularly true in nurse staffing. I think they realized that in a lot of ways, what the world of contingent work, travel nursing in particular, was sort of ground zero of that, offered a better deal, better pay, better hours, more flexibility, more control, all those sorts of things. And so, it's natural, I think, now the world, we can talk a little more about sort of where that's coming back to. But I think that, hospitals and healthcare organizations are sort of realizing now that, the way to solve their talent issue in part has got to rest in improving the deal for their core workforce. And so, the strikes and the pressure on pay and a lot of it on working conditions, I think that is sort of a reset that we're going through as we come out of the pandemic. And what we've seen in healthcare staffing was a huge run up in 2020, 21, 22, and then a coming back to normal in 23 and now into 24. Still at elevated levels from before because the crisis in shortage of workers is still so intense, and that really hasn't gone away. But things are coming back more into balance. And so it's been a real roller coaster ride. I know, back in November, we had our healthcare staffing summit with many of the leaders of some of the largest healthcare staffing firms and a whole range of firms. And, you could see everybody, the sort of whiplash that's been going on over the last couple of years here. So, it is coming back to more normal. And I think, the levels of use of healthcare staffing, particularly travel nursing, was not sustainable for many hospitals. And so it is getting rebalanced now. And I think, the strikes are sort of another sign of the pressure that's on leaders in healthcare organizations to find that right balance for their workforce. So I don't know if that answers your question totally there, Jamie, but
you did
that's
great.
Sort of what I'm thinking about that.
No, you did great. You provided a really compelling perspective on staffing dynamics. So speaking of those shifts, many of our listeners are keenly interested in the role of technology, particularly AI in healthcare. From SIA's viewpoint, how is AI poised to transform healthcare staffing?
Yeah, I mean, we do a lot of research on AI. Obviously, there's a whole range, and we'll get into maybe a little bit of all the ways technology is changing healthcare and healthcare staffing. But AI, of course, everybody's really interested in that right now. It's getting so much attention. I think there's a couple of factors that we found in our research. One is that AI is going to change the skills that are needed out there. So healthcare staffing firms are very responsive to the market, always looking for where are the skill shortages, where can we find the pools of talent, and the like. And I think that AI in a lot of ways is going to, particularly over the longer term, will change the sort of skills that people need. In the shorter term, I think that it's going to help a lot with the worker shortage. So, it's particularly true that, like, if you think of all the areas of the economy, and we look across, all segments of the economy, but, have a particular focus in healthcare, there's probably nowhere in the economy that's more paper pushing. If there's any, if you thought of you'd think maybe there'd just be more, obviously there's a lot of hands-on patient care, but there's a whole lot of administration that goes on. I think AI is going to really help with that, help to streamline it, help to make the healthcare workforce more productive. So that'll help alleviate some of this intense shortage. I don't think it's going to make it go away. It'll change the skills that are needed. I think people are going to need to be more comfortable with, sort of tech-driven skills. In some ways, it should free people up to do more patient care, which I think is great, to do only the things that humans can do, and that, the sort of hands-on work with that. So that's on like the skills side. On the side of like the actual operations of connecting workers with work, which is what healthcare staffing does all the time, I think it's those processes can get better as well. We're already seeing it in some ways in things like skills assessment, helping to automate that, allow the matching process to work better so that you get the right worker matched with the right opening, or like the highest probability of success. all of that is likely to make recruiters more productive. And then there's also the whole administrative side of that. I think it'll take some of that administration out of it and allow them to spend more time with the clinicians, coaching them and being career coaches. So I guess if you get my sort of gist on it, I'm fairly optimistic about it, particularly in the healthcare space. I think there's all sorts of potential negative side effects that are broader societally, and like, are we ever going to be able to trust a video again, or a recording, or a photograph, or all those sorts of things? There are challenges on trust, but in the healthcare space where there's such an intense shortage of talent, I think that it's gonna be a huge plus, and it's got to get worked through. The big challenge in adoption right now is the pace of tech change is way faster than us humans can keep up with.
That's
so
right.
And particularly our institutions, and healthcare institutions are not like necessarily the fastest changing organizations out there, and so that's going to be a challenge as well.
Well, usually their budgets for IT or technology is minuscule compared to what most other organizations have access to. But I really appreciated how you talked about humans wanting to operate at the top of their license and what it allows us to do. So when I think about nurses, right now, currently data says right now that a nurse only gets to touch a patient about 30% of the time.
Yeah.
And so you have nurses who are incredibly, and all clinicians, actually, even doctors, who potentially only get 4 to 5 minutes with each patient, and really we're kind of educated, like, I want to invest time, I want to be able to solve all the problems, and they don't really have access to do that. So I'm really also encouraged by what AI does, because you're right, the thing that I like to talk about, because I'm talking about talent all the time, is the HI, which is the human intelligence, and that's a skill set and a meta skill that right now, with the generations that are coming into the workforce, they really need help and support in being able to evolve that. So I think you're spot on too with how we're going to be able to turn our TA teams and kind of unleash them even in the pre-boarding process on, like, hey, here's the competencies that you're going to need, and here's how you can walk into the door feeling even more confident. So thank you for sharing that.
Yeah, thank you. I think you bring up some great points there, Jamie, and the anything that can get nurses and clinicians like off their their medical record systems and like face-to-face, hands-on interacting with patients, I think is going to be a good thing.
Absolutely. So AI's influence seems to be a pivotal factor for the future. And you mentioned this earlier, but another transformative factor has been the COVID-19 pandemic, particularly in how healthcare is being delivered. So with that exponential growth in telehealth, what do you believe are the long-term implications for care delivery and healthcare employment?
Yeah. Well, I think that's, the pandemic, we're still working through it. I know that everybody is sort of like ready to move on and all that, but I do think that we're still, so much of what's going on in society and in the healthcare system today, it's all like echoes of all the disruptions that we've had. And so, telehealth is one example, right? Like sort of almost immediately we had this moment where things that were like possible before, but just were not things that people were doing, like remote patient care and the like, suddenly became like, we've got to do these things. And so a lot of change came. I think that it opened people's minds to different ways of working, and the long-term implication for that, I think, is only positive, given this intense shortage that we've got for talent. Particularly if you think about rural settings where they just don't have a physician, or they don't have like qualified specialists and the like, or access to specialists. All of that is going to be helped a lot by telehealth. I think that part of what we need to have is, the regulatory environment around that and the licensing and all that. and reimbursement systems
Absolutely.
need to reward that. But I think that change will come. It does seem like we've maybe slipped back a little bit as the immediate crisis has eased. But change moves forward in these sort of step functions here, and so I think long term, it's a real positive for healthcare delivery. It also envisions, frankly, it's a the healthcare system was not devised very much with patients in mind, right? It was devised with the healthcare workers in mind, particularly like around the needs of the physician, like bring everybody into this one spot, have them sit around and wait and disrupt their day. What a great solution to have for at least the things that don't require that hands-on in-person things, that just like a brief conversation with a caregiver. I think that if we can get the reimbursements and the regulations right around all of that, it's going to be a huge upside for the healthcare system, particularly in a time of talent shortage. And just to add on top of that, if we can figure it out, there is a whole global labor force out there, and we're seeing this across the economy. Healthcare gets, a little bit more problematic, maybe, but I think we'll work through this over time, and the ability to leverage workers, across state boundaries or across national boundaries as well, I think is a positive thing for being able to take care of an aging population in a situation where we're really constrained in terms of the workforce.
I really like the premise around how we don't necessarily have a healthcare system that was always patient centric. And now it's almost like we've talked about the demands from the workforce, but there's also demands from patients, right? Because most healthcare plans now give them the option or the opportunity to do telehealth or to go in person. And I think after the pandemic, most people didn't want to go into an office full of sick people if they just needed something checked versus, man, I need immediate care or an urgent care situation. So I love the possibilities of bringing kind of the hospital or care from the home and allowing people to even think about how patient care is delivered. And to your point, then that opens up the possibility of all these beautiful skill sets, diversity, and competencies that may not exist in one area or one city. And now we have the access to go talk to the specialist who's in Italy, who can absolutely help us diagnose this situation. So I love the fact that you mentioned all of that.
I think that's, and if you combine that with AI, I think, just think about, I didn't talk about it before, but you think about these AI systems that are going to help nurses and nurse practitioners do more of the things that doctors do. Yep. And given the physician shortage and all that, I think there's a lot of productivity improvements coming, and frankly, just in the nick of time. So I think that as the population continues to age, and so I think it is. It's an opportunity, and the challenge is just managing through the change and the transition, and those are really the challenges. It's sort of getting from here to there, but it's helpful to at least have the vision of how it can be better.
Absolutely. And then to your point, like, what does that change management strategy look like, and how do you help both patients and your clinicians get there? Yeah. Awesome. Thank you. Speaking of change, looking back at this past year, there have been tons of notable trends emerging. What would you identify, Barry, as your top 3 trends in healthcare staffing this year, and why are those important for our audience now?
Yeah, I think that there's a bunch of important things going on. If I think of like the main categories, and we've touched on some of this before. I think, the first off is just, we've always had this chronic shortage of healthcare workers, or at least, for the last 10, 15, 20 years since I've been looking at the space, this ongoing shortage, it's gotten even more intense. The pandemic sort of lit that on fire. We've got an aging healthcare workforce. And so, that shortage, I think, um, is just an ongoing trend that's like a fact of the world in terms of healthcare workers. It drives a lot of things. One of the things we're seeing with strikes and other is that the talent is increasingly in the driver's seat, and so it's on the shoulders of the executives running healthcare organizations, the folks staffing those organizations, and others, to really adapt to this new reality of how to make work better for the workers who are out there, how to deliver them the flexibility that they need, how to give them the deal that's going to be attractive to them and their life. So that trend has been front and center in 2020, 21, 22, now 23. It's not going to go away. On top of that, the other big thing, and maybe related to that, has just been the pandemic, how that's lit that on fire, how that has opened people's eyes to new ways of working, to maybe some new models, to ways of thinking about the problems differently. And we've seen a lot of the volatility and things that have come through there. And then finally, I would say the impact of technology. And so we talked a little bit about AI, where we've seen a big impact in healthcare staffing in the shorter term. It has been around what we would call sort of the self-service revolution, the digital transformation, the platformization of healthcare staffing. And part of this is driven by workers, and as the newer, younger workers come into the workforce, into the healthcare workforce, they're much more comfortable with a self-service model than older workers. I think about my kids who are in their early 20s. The thought of picking up the phone and having a conversation with an adult
That's
is sort of
scary.
terrifying. And
so scary.
they'd much rather do the research themselves, and they'll talk to somebody if they need to. But if they've got a very specific question, we saw that happen in healthcare staffing over the last, over these past couple of years. The big growth in self-service platforms. It changes the role of recruiters. The recruiters are doing less of the hey, I've got a great job for you here, and more of the, okay, you've found the 3 great jobs that our system matched for you. Let me tell you more details about this. Let me answer your questions. What can how can I help you be prepared for what it might be like to work in this particular setting? What's the sort of inside scoop? So, we touched on that a little earlier. It's sort of letting the machines do what they do best and letting the humans do what they do best. And so that whole tech revolution, I think, has been changing the world of healthcare staffing. The technology revolution has been changing, at pretty much every part of the economy. What is the saying, that software is eating the world? And I think that's true in many things that are tech driven. AI is sort of the new cool, sexy part of this, but there's a whole bunch of other digital transformation, algorithms, process changes that are tech driven, and those are still playing out right now. That's going to change. It already is changing the way that people get connected with work and the way the processes run around that.
Thank you for those trends. I think those are very real and still very current. I also like to think about this technology kind of burden that they're all facing because they're trying to catch up to what's happening, and AI is making everything change at a different pace that even most systems can stay up to date with. And so I liked how you talked about processes Because what I like to do when I'm coaching leaders too is also trying to help them think it's great to have a technology, but if you have outdated processes, all you're going to do is try to then implement those into a technology, and they're not going to solve your problem either. So it's really a combination of how do you make sure that you're optimizing your workforce, your processes, and then using technology to enable kind of that change and that transformation.
That's a nice way of summarizing that sort of people, process, technology. You've got to get all three of those correct for sure.
Awesome. So Barry, tell me what you're predicting for healthcare staffing in 2024, and do you expect any new trends or a continuation of any of the current ones?
Yeah, I think that part of what we do for leaders of healthcare staffing organizations and is, forecast like spending in the industry and the like. We saw huge growth through the 20, 21, 22. It came back to earth in 2023. This is particularly true in the nurse staffing business. 24, I think, is shaping up to be more moderate. Closer to flat, I think, in terms of growth on the nurse staffing side, maybe still down a little bit, just renormalizing depending on where you are. We're seeing a lot of growth in allied health. Allied is such a disparate area. It's basically, as we categorize it, it's sort of everything clinical other than nurses and physicians. So there's a whole bunch of different skills in there. But more growth there. On the physician side of thing, the growth was sort of muted in 2020 and 21, and has recovered now. And that's sort of right now fastest growing area in healthcare staffing. We think in 24 is going to be the locum tenens, temporary physicians. That's sort of come back. As far as the so that's sort of the big macro stuff. As far as the other trends, I think one of the things we're seeing is organizations starting to rethink their whole talent strategy, and particularly we think about things like talent pools and direct sourcing, and what we would call total talent acquisition. The idea of organizations thinking holistically about all the different types of talent that they need, and trying to get ahead of the curve a little bit. I think healthcare organizations have tended to be quite reactive of, the crisis of the day. Oh my God, I need 50 nurses here, or 20 X-ray techs, or whatever it is. And try to get out in front of that and think about which jobs are best part of your core workforce, which are part of a fluctuating contingent workforce, a little bit of planning and building of pools of talent that can help with that over time, and just thinking in a more holistic way around the whole talent equation. So those are some of the things that we're seeing in 2024. And then, of course, the final thing, it does seem to be calming down a little bit, but there's been a lot of sort of legislation or action going on around, government tends to be sort of a lagging indicator, I guess, on things like that. And so there's been all sorts of interesting things going on around the use of healthcare staffing and the like. And I'm not sure what's going to become of all of that. It does seem, that the market has largely taken care of it. So I suspect, we may hear a few more things about that, but that largely those sorts of things may tend to go away in 2024.
Awesome. Thank you so much. Predicting future trends is always fun in light of those trends
we'll have
and
to
challenges.
Check back at the end of the year, and you'll see how I'm doing.
Oh my gosh, absolutely. That'll be your scorecard, Barry, this year. To be like, how close was I? I do like the fact, though, that you mentioned kind of those demands now that our government is putting on, even specific to states where they're talking about ratios, right? And so we know ratios always have implications on the workforce as well as patient care. So I am really excited, if I think from a regulatory perspective, to see the government really putting demands on hospitals and in states specifically to ensure that our nurses and our clinicians are safe in their environment, and so are the patients.
I think part of that, that'll go to the core of a lot of the issues that the healthcare workforce has, right, is around just the staffing levels and the burnout and all of that. There's a whole, it gets so complicated with the financial element of this and ultimately the reimbursements that hospitals receive and all of that. So we're fingers crossed that all that will work out.
I hope so as well too. So in light of those trends and challenges, innovative solutions are often born. So what I'd love to hear from you are what solutions or adaptations are you seeing within healthcare organizations to ensure efficient and effective staffing?
Yeah, I think I sort of touched on those a little bit earlier. I think the more holistic thinking about total talent, this idea of thinking in an integrated way about all the different talent sources, the adoption of technology and platform type of technology, the impact of AI, I think. And as we sort of down the road here to help more, I think rethinking of processes around the needs of the workers and the patients. I think there's opportunities in all of that, and for healthcare organizations, I guess the other thing I would say is just like a rethinking of the deal that they're offering to their full-time workforce as well as to the the contingent workforce, to make sure that they're sort of using in the right way those different talent sources and making sure that they work together as effectively as possible. We do see that some organization, there's definitely this interest in sort of direct sourcing and use of talent pools and things like that. And that does seem to be growing as well. I think, that the key challenge for leaders there is to find the right balance and what they need by like particular area, by skill, all the different, there's not like a one size fits all solution for all cases. This is a multifaceted challenge, getting the right staffing levels.
Well, and every hospital is going to be on a different journey. And also, I think about from a maturity model where they want to grow, and then their ability to ingest that change is going to be important as well, too.
Yeah, absolutely.
So we know that adapting to change is crucial, Barry, especially considering the workforce dynamics in recent years.
Particularly in nursing homes and skilled nursing, where there's, a particular shortage there. And I think in a lot of ways, the reimbursement models there for the whole nursing home industry and the like is really challenging. And so they've got an acute shortage of workers there. And it's basically about the deal and the ability to pay people for a challenging job. And I think, that plays out across all the different areas of healthcare staffing, but particularly acute there. And I think it's an ongoing challenge to retain an aging healthcare workforce, to grow, to bring in new workers into that workforce. And I think that there's not like a simple solution to this. There's it's an all hands on deck solution for sure.
Oh, thank you for that. And we've talked a little bit about that for most of our conversation when we talk about the aging population, the different demographics that are in the workforce, their needs, and then also the needs of the patients as well. So thank you for that. When you think about all of these trends, which are crucial for planning, another factor including all sectors, especially in healthcare, is the economic environment. Considering the current high levels of inflation, what impact do you foresee on the healthcare industry and on patient care specifically?
Yeah. Well, healthcare costs have always been going up higher than inflation overall. I mean, the good news is I think inflation in general is moderating. We've seen this throughout the world as, the pandemic, just with the supply chain shortages, caused a lot of that. What isn't going to happen is that, like, prices are not going to go back to where they were pre-pandemic. And so, the rate of inflation, inflationary increases, I think, are going to slow, and they already are. So I think it's that always it's going to be it's going to cause pressure, I think, on the healthcare system, in terms of spending and the like. But I do think that we're going to see it normalize a little bit over the next couple of years. As far as the longer term, I think it's a big challenge. I mean, a lot of what we see in the healthcare system is driven by government policy, particularly in Medicare. And the Medicare system needs to get fixed at some point, I suppose, is, it continues to eat up a greater share of government spending in particular. So it's an ongoing challenge. I think it has come back to more, or is likely to go back to more of the normal challenges that we had as pre-pandemic, but it's still, there's still sort of a looming crisis out there about, like, how we're going to fund the U.S. healthcare system over the longer term. And, that I think is at some point we're going to have to figure that out. I'm not sure, given where we are right now politically, how exactly that will play out, but it certainly will need to get handled at some point.
I think that's also a pretty big imperative. I think we've been noticing over the last decade the rising of healthcare costs, and now that we have this inflation, I think the implications are pretty massive. And I think, to your point, I don't know how we solve that first world problem, but I know we need to do that.
Well, at some point, right, healthcare costs can't take over the entire economy. It crowds out all sorts of other spending as well. So there's all sorts of choices. None of them are particularly fun, but I do think that it can. The great news is that there's a lot of technology and tech-driven change that's out there, which can make healthcare more affordable. And so, if you get the right policy lined up with that, we can find a way to sort of drive, at least get healthcare costs to keep more in line with economic growth. So it can be done. Innovation, technology, I think, is a lot of it. And then, growing that healthcare workforce.
Absolutely. I also like to challenge people to think about some of the other aspects that influence a person's health, right? So when we think about dietary needs and our food supply and the things that influence that, to whether or not we have people that are able to eat well on a daily basis, that has implications, obviously, on our healthcare system as well. Well, Barry, this has been an amazing conversation. I just want to say thank you so much for all of your insights. I have one final question for you. I ask every single one of our guests. If you could challenge our audience to take one specific action or adopt a mindset shift from today's conversation, what would that challenge be?
Yeah, you got me there, Jamie. That's a tough one. Yes. One specific action. I think that I guess I would encourage people to think more holistically about their talent, and to think about just to have a mindset that what we would talk about, this sort of total talent approach to your workforce, and think more broadly about the full range of, like, what is the right type of worker for the work that needs to get done? Where can you find these pools of talent outside of the traditional ways that maybe you've done it in the past? And how can you use that sort of more broad thinking to solve the key issue, which I think healthcare organizations have, which is this ongoing chronic talent shortage. And so I think there's a lot of opportunity for more creative thinking there.
Awesome. Barry, thank you so much for your time today, my friend. It's been wonderful.
Thank you, Jamie.
Thank you for joining us today on Elevate Care. We hope you enjoyed this episode. If you found this podcast valuable, please consider liking, subscribing, and leaving a review on your favorite podcast platform. Your feedback means the world to us and helps us to reach even more listeners like you. You can learn more about our show on our website, amnhealthcare.com, and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare. Thank you for being a part of the Elevate Care community. Until next time, keep elevating healthcare, and remember that together we can create a brighter, healthier future for all. Special thanks to AMN Healthcare for making this show possible.